So the first thing I would do is verify the doctor's orders. After that, I would go through the first 5. First is to complete the concept of hand hygiene by washing your hands or applying a hand sanitizer. After that, I would identify the patient based off of 2 identifiers, such as name and date of birth. After that, I would ask the patient if he or she has any allergies. I would protect the patient's privacy by pulling the curtain or closing the door, and I would educate the patient on the reason for today's visit. After that, I would want to remove all my packaging, which I've already done, and I would want to apply a pair of gloves. Okay, so the next step is to clamp the tubing. Right now, the tubing's already clamped. It's in the locked position. So basically that means whenever I push or pull on it, I won't be able to move it. I want to start the video out with the tubing in the locked position, but I'm just going to show you how you would lock it and unlock it. So to unlock it, you would slide this. And now as you can see, the tubing slides through. You can move it. And now I'm going to lock it so that I can get started. So now that it's locked, you can't slide it. So after that, the next thing I would want to do is spike. So first I'm going to remove the plastic off of this tip, and then I'm going to remove the blue piece off of here. I'm going to stick this in, make sure it's in all the way. Then I'm going to hang my bag. I'm going to make sure that the solution isn't expired, and it's not. So the next step for me is to fill the chamber 50% by pressing down. Might have to do this a couple times to get it halfway. Okay, so it's about at half. So the next step is going to be to prime. I have to be careful whenever I'm untangling this because the tubing should never touch the floor. Okay, so next what I'm going to do is I'm going to prime, but first I'm going to put the end of the tubing into this cup so that it doesn't spray out everywhere whenever I prime. Okay, finally got it in there. Okay, so what I would do when I prime is, in the beginning I showed you how to unlock the clamp or unclamp the tubing. So to do that, I would just slide it forward. And whenever I'm priming, I'm just watching as the solution flows through. I'm making sure there's no air bubbles. And after I've checked that out for a minute, I'm going to lock it back up. So there's no air bubbles. Everything's good. So after that's done, I'm going to take a look at the, I'm going to assess the insertion site. I'm going to make sure there's no swelling, no redness, no leakage. I'm going to ask the patient if they have any burning pain. If everything looks good and none of that stuff is present, then I'm okay to begin flushing. So before I start flushing, the first step is to swab the port on the extender with an alcohol swab for 15 seconds. Alright, so after that's been swabbed for 15 seconds, gonna give it a couple seconds to dry. And then the purpose of that is because we're going to flush the port on the extender with 2 to 3 cc's of this saline. So I just connect that by screwing it together. Okay, then after that's complete, I would unscrew. Throw that in the trash. Next, I'm grabbing the end of the tubing. This is once I take the cap off, this is sterile and this is considered clean, so I'm connecting sterile to clean. And I'm just screwing the two together. So after I've screwed those together, everything's done. I would want to calculate the drip factor using dosage calculation. I would want to label the IV with my initials, date, and also the time. I would want to resume everything at the proper rate. And of course, I would want to always support the concept of safety through everything that I do, and I would want to document everything that I did today down in the patient's records.